Good morning, everyone, and welcome to the European Public Health Conference in Lisbon. I ask you all to take your seats, please. Apologies for those that are in the different auditoriums, but also a warm welcome to the conference for those that are watching from their homes, from their offices, through the streaming. And this first opportunity, I would like to greet Lorena Boix Alonso. She's the Deputy Director General. Very welcome to the conference. I would like to greet both Iveta Nagyova, President of UFA, and Tito Albrecht, the President-elect. I'd like to greet Martin McKee, who's the President of the EPHC Conference Foundation. And I'd like to greet you all the organizations that are present, all the participants, and I'll leave you to a very brief musical moment, the Ode to Joy, which is of course very meaningful for us all Europeans. So I invite to the stage Aleix Franco, who will interpret Ode to Joy. Thank you so much for this wonderful song that resonates with all of us. And now, I also have the pleasure to introduce Yura. She's a wonderful fado singer, and she will share with you a song about Lisbon, about this young lady, Lisbon. Yura, welcome to the stage.
Good morning, welcome to Lisbon. No castelo, ponho o cotovelo em alfã, descanso o olhar e assim desfaço o velo de azul e mar. A ribeira encosto a cabeça, a almofada da cama de tejo, com lençóis pegados à pressa, na cambreia de um beijo. Lisboa, menina e moça, que os meus sonhos veiam tão pura. Teus cheios são as colinas, farina, pregão que me traz à porta, ternura. Cidade a ponto luz, bordada, toalha à beira-mar, estendida. Lisboa, menina e moça amada, cidade, mulher da minha vida. No terreiro eu passo por ti, mas na graça eu vejo-te nua. Quando o pombo te olha, sorri. És mulher inventar aguardente de vida e medronho que me faz cantar. Quem violente? Lisboa, menina e moça, menina da luz que os meus olhos veem tão pura. Teus cheios são as colinas, verina, pregão que me traz à porta, ternura, cidade de ponto luz bordada, e a tua olha à beira-mar estendida. Lisboa, menina e moça amada, cidade, mulher da minha vida. Lisboa do meu amor deitada, e a cidade por minhas mãos despida. E Lisboa, menina e moça amada, cidade, mulher da minha vida. Thank you so much. Aloysio Franco.
Muito obrigado. Obrigado. Thank you so much for this very emotional moment for us here in Lisbon, because this is actually the hymn for the city. It was approved recently. So now to the content. So this is the theme of the conference, Sailing the Waves of European Public Health, Exploring the Sea of Innovation. And we are very keen on this topic because we indeed are a sailor's nation. We have the Atlantic Ocean and we set sail to discover new opportunities in far places along the world. And for us, innovation has been a core item in development of new solutions, in promoting health, in finding better opportunities for health for all. Indeed, this is a topic that's very keen for the city as well. City is currently the innovation capital of Europe. It was voted last year. Today, the new innovation capital will be presented at the Web Summit. As you know, it's taking place and we have 70,000 people here as well discussing innovation, startups, and a lot of technology as well. We had the same topic back in 2008. It was the European conference we had in 2008. We had the opportunity to share with you. And I see a lot of familiar faces from 2008, but I also see a lot of familiar faces from this year. So who's here for the first time? Wow, so a lot of people are here for the first time. And I'm gonna ask someone to change my clicker because it's no longer working, or is it back? Okay, so this is the billboard for the conference in 2008. And indeed, we had a very amazing time then. So we're happy to have you all back here. And we have 3,000 people registered for the conference. So you are really the key participants. We are the key aspect for the conference. And in fact, well, I'm so happy to have you all here that I'm going to take the chance to take a selfie with you all. So I like to ask the room to be well lit so I can take a better selfie. So can I have the lights in the room, please? So, smile. And I'll post it on social media so you can identify yourselves. Okay, so indeed, there's many of us here. So we unfortunately had to close registrations more than a month ago. So we are indeed sold out. So we ask you for your patience and understanding on dealing with the eventual queues. Eventually, consider having a plan B. Maybe the session you wanted to attend will be fully booked. There won't be room anymore, so try and find something else. We have so many things happening at the same time that I'm sure you'll find something interesting. Lunch boxes will be distributed along the venue, so if there's a queue somewhere, probably elsewhere, you can find it very easily. Do rehydrate at the different water stations, and feel free to refill your water bottles, and do visit the stands, because we're looking forward to interact with you all. And of course, there are a lot of interesting things being shared. We are an inclusive conference, so we have absolute zero tolerance to bullying, sexual harassment, or any sort of discrimination or hate speech. So if you do feel that something is not for that. But we have a lot of tolerance for interaction and networking. So do find your UFA bracelets at the UFA stand. Do find the pins. And indeed, there's 10 different pins, and I also incentivize you to try and find all of them. And you probably need to exchange, because you won't be able to get 10 from the booth. So try and exchange with the rest of the people and exchange your own. This is actually the conference bag from 2008. So it's a relic from the past where sustainability was probably not on the top of the agenda. But I have it inside here, and I'll show you. I have connections with the organization, so I did manage to get all 10 of them. So, but I'm willing to trade. So feel free to reach out, and I'll trade with you some of the pins. Okay, so content-wise, we're very happy to have here a lot of the people who've made and shaped public health within Portugal and in Europe. And I also take the opportunity to greet Ana Paula Martins, our dear health minister, who will also take the floor in a couple of minutes. But for now, I invite Sara Cerdas to take the floor to present her view also on innovation. Thank you so much, Sara.
Thank you, Ricardo. Ladies and gentlemen, distinguished guests, fellow public health professionals, good morning and welcome to Lisbon for the 17th European Public Health Conference. I would like to take this opportunity to thank UFA and our incredible hosts for this opportunity. For me, it's an honor and a privilege to address you today. Not just as someone who has served the last 5 years as a member of the European Parliament, but as a medical doctor in public health who deeply believes in the power of collaboration and evidence-based action. Because public health sits at the intersection of science, evidence, and action, and each one of us today carries the immense responsibility of not just advancing knowledge, but of ensuring that that knowledge becomes the foundation of policies that protect and improve the lives of citizens. Throughout my time in the European Parliament, I have witnessed firsthand the critical role of science in shaping policies. Whether when it was negotiating the EU for Health program, the European Programme for Health for 2021 to 2027, or championing the EU's Beating Cancer Plan, or leading on the first mental health report for the European Parliament, or even creating the new European database, to name a few, the driving force behind every success was evidence. But evidence alone is not enough. It must be transformed into actionable policies and initiatives, and that requires continuous effort and advocacy. Because we know that if we prioritize health as the cornerstone of societal investment, we can unlock immense potential for our collective well-being and future. Health is indeed a political choice. But here's the challenge. How often do we truly see health portrayed as an investment? Too often, health is framed as a cost, something that drains budget rather than drives prosperity. And this mindset needs to change, and it starts with us. Because every euro invested in public health returns manifold in terms of economic productivity, reduced healthcare costs, and improved quality of life. Each euro invested will return in healthier, more resilient populations, in happier, more productive societies, and in sustainable systems that leave no one behind. As I reviewed the supplement for this conference, I was struck by the recurring themes on the key stakes, which were all of them, calls to action to policymakers. And that reminds us that public health is not just about understanding problems. Public health is about solving them. So the ultimate test to our work is not on the number of publications the number of studies that we publish or the number of presentations we give. The ultimate test to our work is in the real world changes that those studies inspire. And public health professionals are uniquely positioned to bridge the gap between science and policy. And we should not wait for policymakers, politicians to come to us. Trust me. From EU to national to regional to local, every level is a touch point, an opportunity to influence and implement evidence-based policies. And I want to be direct today about something that often makes public health professionals a bit uncomfortable, which is lobbying. Public health and lobbying might seem like an odd pairing, but if we want research and evidence-based policies to lead the real change, we must lobby for them. So lobby your findings, advocate for them tirelessly. EPHC 2024 is much more than just a conference. It is much more than just a gathering of great minds. It's a movement. Over the next few days, we will sail the waves of public health innovation with the Tagus River as our background, and we will explore solutions to some of the most pressing challenges of our time. And together, we can ensure that these findings shared here do not only remain in the realms of this conference, but become the catalysts for policies that protect and promote health, for policies that reduce inequalities, for policies that drive innovation, for policies that can transform lives. Together, let's champion for health as the most crucial investment of our time, because when we invest in health, we are investing in our collective future. I take this opportunity to thank you all for your dedication, your passion, and your relentless pursuit for a healthier, more equitable world. Let's make waves together. Thank you very much.
On stage, but it's fine. I just wanted to give you a small gift. This is actually from one of our most well-known Cerdas, and it's sardine, so it's also simple. Okay, so I haven't been sitting down, but you have. So we'd like to propose an active break. It's very brief. It can be adjusted to all different capabilities, but I'd like to invite on stage Sofia Franco and Inês. They're experts in physical activity and health, and they'll briefly incentivize you, according to your ability, for some physical activity. Thank you.
Thank you. Good morning. So let's take an active break together. Okay, nice. I will ask you first to please stand up. Wow, thank you. So make yourself comfortable and please be aware of the people around you so you don't hit anyone with your arms. Let's start. So first, take a deep breath in and stretch your arms and stretch all the way through the ceiling. And exhale. Just one more. So deep breath in, stretch your arms, and in this position, we are going to flex our upper body to this side, and now to the other side. Okay, just with a bit of more coordination, so the photo and the videos, yeah, we are doing all the same side, so this one, and now the wave. Woo, nice. Just one more time, and woo, nice. Now, with your arms, we are going forward and feel the stretch with your chin towards your chest, and then with your arms spread like this. We are going to feel the stretch on our chest. And just one more time. Go forward, just like this. And with your arms like that, stretch, stretch, stretch. And now, for the final exercise, we're going to do just a tiny squat. So with your arms, don't worry. So just watch me first. Don't worry if you feel a bit silly. We're not trying to play cool. So just a tiny squat. And now, I think you can do better than that. So let's go. Just 2 more times. So tiny squat. And now, no. And now wait. 1, 2, 3, and just one more time. Make it count. So with me, tiny squat. 3, 2, 1, and thank you so much. Thank you. So have a pleasant conference, and please check on the website for the exercise program. Bye-bye.
Thank you, Inês. Thank you, Sophia. Thank you, Inês and Sophia. So indeed, there's a lot of physical activities. Look it up on the website. We'll have today a walking bus. It's a walking bus, so you will walk toward the reception. So look it up, and we'll have videos on the parallel sessions also to practice a small period of physical activity. So do include it in your daily routine. It's very important for the health of us all. So now back to our speakers. And I'd like also, before I give the floor to Lorena Boix Alonso, I'd like to acknowledge a very good friend and very close to UFA, Natasha Azopar de Muscat, a good friend. And she's here representing WHO. She's a former UFA president. So welcome again. You're at home, as you know. Thank you so much, Natasha. And now it is my great pleasure to introduce the Deputy Director General for Health, Lorena Boix Alonso, and she'll give us also a speech. Thank you so much for taking the time to be here with us.
Thank you very much. This is very impressive. This is my first European Public Health Conference, which is not surprising because I'm in office only for 4 months. I was appointed. So I'm really happy that it takes place in Lisbon, because it's a city that is, for many reasons, very close to my heart. But I'm even happier about the subject of the conference, exploring a sea of innovation. Because we are indeed navigating the complexities of a rapidly changing world where health, technology, and innovation are increasingly connected. And I must say that this conference coincides precisely with the moment where in the European Commission we are in a transition period. Right now, as we talk, the new commission is being formed, so our commissioners change. And it's the moment also where in the commission we set our new priorities. And I have to say that the priorities for health are extremely ambitious, and they all turn around precisely the subject of innovation. And I will briefly mention how innovation is so linked to the priorities of the new commission for the next 5 years. But let me first insist why innovation is so amazingly important in the public health sector. We all agree that the sector is facing very, very, very challenging situations. From our European healthcare systems are facing pressure, whether it's for aging, workforce, healthcare costs, and it's clear, and we are really convinced in the European Commission, that none of the challenges that today the health sector is facing can be addressed without innovation. And let me give you a few examples. The cost of healthcare. The rising cost of healthcare is one of the most pressing challenges. Innovation can, at the same time, reduce those costs and increase the quality and efficiency of care. Let's take biotechnology, a personalized medicine. They can provide more effective and targeted treatments, and like that, they are reducing the need for expensive and prolonged therapies. Digital health tools and AI-driven efficiencies can also help streamline the healthcare delivery, minimizing waste and reducing overall expenses. Also, innovation in medical devices. They help alleviate pressure and enhance also treatment quality. For example, just an example, imaging software powered by deep learning. They are already now supporting clinicians with more accurate and faster diagnosis. For instance, in the detection of early stage cancers. Wearables are no longer an issue of the future. They are already helping patients monitor vitals at real time and empowering them to manage chronic conditions more proactively, which is going to allow healthcare providers to intervene earlier, reducing hospitalizations and therefore costs, and at the same time improving quality of life. Another challenge that we are facing, workforce shortages, which, by the way, is being exacerbated by an increasing demand for services, which of course is linked to aging, etc., etc. Well, here as well, artificial intelligence can help alleviate some of this pressure by streamlining administrative costs and allowing, therefore, healthcare professionals to focus on what they should be focusing, which is patient care. Another challenge of public health sector, health inequities. Health inequality remain another significant challenge across the whole of the European Union. The rapid growth of digital health technologies, including telemedicine and mobile health applications, are creating new opportunities for improving access to healthcare services to undeserved populations and ensuring that everyone has the opportunity to achieve optimal health. Another example, non-communicable diseases. They continue to be a major public health concern in Europe. Innovation, again, can help us better understand the root causes of these diseases and develop more effective prevention and treatment strategies, empowering individuals taking control of their health. Cancer remains one of the leading causes of health, and emerging technologies like genomics or biotechnology are making a real revolution of our understanding of cancer, of course, opening new adventures for therapy. All these are just examples of how innovation is basically what is going to drive our response to these challenges. Now, of course, innovation can only happen if there is trust in it, and also if there is an environment that attracts innovation. In the previous commission, so the last 5 years, we have been delivering a lot of pieces of legislation to create this trust. And we have the AI Act, we have the e-health data space, and I know that you are going to discuss these subjects later on. Cybersecurity rules, the pharmaceutical reform. These are pieces of legislation that address the challenge of data protection, privacy, cybersecurity, to ensure precisely this trust. Now, the new commission, when you read the mission letter and the priorities that the president has given to the future new commissioner, you see a lot of innovation and a lot of emphasis in attracting precisely innovation. One of the fields and one of the deliverables of the new commission, for example, will be a Biotech Act, the adoption of a Biotechnology Act. And the objective of this act will be to reposition the European Union biotechnology sector as a global leader and supporting the sector where needed. I mean, we know that genome editing tools, mRNA technologies, synthetic biology are already demonstrating huge potential. And we know that the European Union has traditionally been at the lead of this type of innovation in the science sector. Now, unfortunately, and we need to say it clearly, the indications is that we are losing this leadership. We continue to be really good at basic and research, but when it comes to the deployment, we are failing. So the objective of the Biotechnology Act is going to be to put us again there at the forefront. Just to conclude, let me mention other priorities, and there will be a workshop today on priorities of the new Commission. Isabel de la Mata, who is sitting there, will be there from the European Commission, so please go to it if you want to know more. But another priority, for example, is to help our researchers and developers and even producers to use artificial intelligence and to navigate in all these pieces of legislation that we have delivered. So there is also, as a priority, to provide guidance on the use of artificial intelligence in the medicinal product whole life cycle. And here we will work, of course, on work already done by the European Medicines Agency, for example, to leverage the use of real-world data. And this is just an example. Another issue mentioned in the mission letter of our new commissioner is the scaling up of genome sequencing. And another one, very important, because you cannot have any of this innovation without cybersecurity, is that the President of the European Commission has announced as a high priority, so that in the first 100 days of the new Commission, which will, let's see, be in place probably next month. In the first 100 days, we will deliver an action plan on the cybersecurity of hospitals, just to show how these aspects are so important for the new Commission. So I'm going to leave it here. Plenty of innovation ahead of us. And as we navigate the waves of innovation, let us make sure that, of course, the objective behind innovation is not an end in itself. It has as objective to ensure a healthier, more equitable Europe. Thank you very much. Muito obrigada.
Well, thank you so much. Thank you so much for your wonderful presentation. And this is also a sardine from our behalf.
I love
Thank you so much.
Thank you.
Thank you. So also I wanted to share something which I failed miserably, because it was really impressive when we were doing the physical activity. We were really shaping the waves of European public health. So I'm going to ask you at the end so that we can replicate that, and I'll do a video of the wave, okay? But it won't be as effective as our specialists in physical activity, but I think we can build an image that's interesting. So next, I'll like to invite our Minister of Health, Ana Paula Martins, to give you also a few words on, I know she has a very busy schedule, so we're very happy to have you here today. So welcome to the public health community. It's actually her community as well, because she's a pharmacist and she's been working in public health for a long time as well. So welcome.
So, first of all, good morning. It's wonderful to be here. Deputy Director General for Health of the European Commission, Doutora Lorena, Boix, President of EUFA, Doutora Iveta Nagiova. I hope I'm not, saying wrongly the family names. Dear Natasha Zopardi from the WHO Europe, Chair of the conference, dear friend Ricardo Mexia, ladies and gentlemen. Sailing the waves of European public health, exploring a sea of innovation. What a magnificent heading for this conference. A heading that reminds our sailor past, for the Portuguese, of course, our sail in direction to new worlds and in opening new frontiers. A heading that reminds me of our privileged relations with all countries of Portuguese language. where we can take these messages for the creation of a new vision of a modern healthcare. It is a great honor to welcome you all to Lisbon, where we gather as a community of professionals, thinkers, and advocates dedicated to advancing public health across Europe. Portugal is deeply committed to the values and goals. We share protecting health, promoting well-being, and building resilient health systems that support all citizens. Today, I would like to address you some critical areas that reflects Portugal's path forward and our shared vision for a healthier, more resilient Europe. First of all, as Health Minister, let me deeply stress the role of public health in creating more strong and resilient health systems. About the role of public health in the new National Health Service structure, let me speak on the evolving role of public health within our National Health Service. As we make the transition to a model based on local health units, we are positioning public health as a core component, acknowledge that prevention and health promotion are vital strength towards a healthier society and a more sustainable health service. Our ambition is embed public health efforts within these local networks, ensuring that every community has access to preventive care and robust health promotion resources. We are strongly working in the reorganization of all the public institutes or organizations that deal with public health. We consider a major priority increasing the capacitation to respond to major threats, both national and international. Public health professionals have to be central in this transformation, guiding not only local decision-making, but also ensuring that each intervention promotes better health outcomes. We deeply recognize that more relevant paper of our health authorities. The recent duplication of the amount of financial supplement attributed to them is a clear sign of the government commitment with this public health workforce. Investing in prevention and health promotion policies is clearly a national priority, as I mentioned. This option brings me to the essential need for investment in disease prevention and health promotion. Every euro we invest in preventing illness and promoting wellness has a multiplier effect, not only in reducing healthcare costs, but in strengthening the vitality of our communities. We are committed to policies that prioritize prevention, shifting the focus from merely treating disease to actively preventing it. We know this requires innovation, strategic partnerships, thinking strategically, and a strong public health workforce. I urge all of us to push for policies in our respective countries to make prevention the cornerstone of our health system. These are options that we consider non-negotiable. That's why we prioritize them in our state budget for 2025 that I presented yesterday at the Portuguese Parliament Assembleia da República. A One Health approach, collaboration with veterinary and environmental sectors. We will strongly support it. In Portugal, we understand the critical importance of a One Health approach. We are far from that, but we are pushing forward. Health is interconnected between animals, humans, and our environment. The challenges of zoonotic diseases, environmental degradation, and ecological footprint of our health systems are not isolated issues. They are interrelated and impact all of us. In collaboration with veterinary and environmental sectors, Portugal is committed to a proactive and sustainable approach that reduces the ecological impact of healthcare. We must work towards green healthcare practices with a reduced ecological footprint and greater attention to environmental health, which is health for all. The urgent need for public health emergency legislation, I, as a health minister, will stand for it. The COVID-19 pandemic was a stark reminder of our vulnerabilities and the need for strong legal frameworks in public health emergencies. And in Portugal, we recognize the urgent necessity of a comprehensive public health emergency law aligned with the new international treaty on pandemics. This law must equip us with the flexibility and resources to respond swiftly and effectively to future threats, protecting public health while respecting, of course, fundamental and constitutional rights. Ladies and gentlemen, I strongly hope we can work together across nations to harmonize our legislative frameworks and create a safer and more resilient Europe. As our world becomes more interconnected, the importance of collaboration between countries becomes ever more apparent. Health threats do not recognize borders, and neither should our responses. Here, I'm pleased to announce that Portugal is committed to strengthening its partnerships with the European Union and beyond, sharing resources, data, and expertise. Together, we are stronger. And by building a unified European public health strategy, we can respond to health crises more effectively and create a healthier future for all citizens across this continent. Furthermore, we must and we will adopt health in all policies. Health cannot be an isolated issue managed solely by the health sector. Our cities, agriculture, fisheries, education, research, and innovation, all these sectors impact public health. Each must align with the goal of protecting and promoting health, ensuring a unified approach across policy domains. And we know that it's not easy within our governments. We must work with municipalities, educational institutions, and agricultural bodies to create environments that foster health, moving towards a system where every policy, regardless of its primary focus, supports the health of our people. Finally, I want to underline the centrality of our national health plan in guiding our national policies. This plan is not just a document. It is a blueprint for building a new society that prioritizes health as a fundamental human right. It aligns our public health goals, setting measurable targets and ensuring accountability across sectors. Our national plan for health will continue to serve as the foundation for our public health strategies, driving forward initiatives that foster health equity, reduce disparities, and build a healthier Portugal. Ladies and gentlemen, dear guests, we clearly must be more adaptive to new social and health challenges. All days we are facing new and relevant health and social inequalities. Migrations show that every single day in this country. We should challenge ourselves every day to find new solutions and innovative strategies, ensuring a better and true equity concerning the access to healthcare. This is a huge challenge that I'm sure that all of us share in our countries. And finally, I do think that we must remember that we should use never and ever better all the instruments that support a modern social marketing for healthcare. We should increase our use of innovative campaigns, digital strategies, and community engagement techniques leading to better and healthier ways of life. Thank you all for your dedication, and thank for joining us in Lisbon to shape the future of public health in Europe. As have been said, this is not only a public health conference. I do think that in this crucial moment is much more than that. I look forward to your discussions and our discussions in the shared solutions that will emerge from this event. Together, I'm sure, we are all sure that we can build a better Europe where every citizen enjoys the right to a healthy and fulfilling life. Dear friends, dear guests, enjoy Lisbon and Rio Tagus or Rio Tejo. It's just in front of us. Thank you very much.
You know, our minister,
Oh, it's my gift.
it's your gift.
Oh,
Thank you so much.
great. Thank you so much.
Okay, so we're now nearing the end of the opening session, and we're going to have a premiere now. So this is the first time we're going to have the premiere of what aims to be Public Health, the musical. Sounds great, right? So it's my honor and pleasure to introduce Pedro Fontes, who will be interpreting one song of that potential musical. Pedro, you have the floor.
It was just another morning, warm coffee in my hand, a back bus riding through familiar land. The phone buzzed once through the hum and noise, and I got the tremor in my mother's voice. I recall the night when we struggled to breathe, an illness we thought would simply ease. The doors were closed and time ran thin, the life slipped through the cracks within. They said if only we'd caught it soon, but you were gone by the rise of the moon. I was left with questions and aches so wide. How could care be there and yet denied? You taught me more than medicine could, that healing means more than wishing it would. So now I stand with your memory near, driven by the loss of a soul so dear, fueled by the promise to those like you. world that's aching and it's time for a fresh start. A system built for healing that's more than just a cure, where everyone is valued and the future feels secure. I'll bridge the gaps where hope is thin. Fight for the change that must begin. With knowledge care, I'll see it through. My mission's clear, there's work to do. I dream of a world where health can thrive, where people and nature come alive. Less pollution, more connection, building up a shared foundation. In every town, in every place, we'll build a safer, healthier space. Together we rise, we'll thrive in a world where health can thrive. It's more than just the body, it's the mind and spirit too. A life where social ties are strong and neighbors welcome you. We'll push for better leadership, a change in paradigm, and heal our civil servants accountable in time. No more